specifically ADH, Department of Health, within whatever city or town you live in, Department of Health. And they said it was supposed to be cut towards really COVID funding, which, if you know,
it's still not over with.
No, it's not. However, COVID funding falls under the branch of epidemiology,
which tracks communicable diseases.
If you start cutting the pieces that falls under epidemiology, because a lot of times people are on a grant, right?
Mm-hmm.
The majority of the time, they're not on one specific grant.
And grants don't last forever.
They don't. They last for 5 years, 10 years. But they may be on this grant that's researching cancer in a certain area, right? This branch, this line that was specifically tracking COVID in this county, whatever.
Mm-hmm.
It can get that detail. But if you start to remove that, now you start to, each piece you remove impacts a person's paycheck, their salary.
Yeah.
Because they might be 30% here, 60% there. And if you just remove, 60%, now they're only funded at 30% or 40%. So you have to find that 60% somewhere else, right?
Mm-hmm.
So when you start to remove the COVID grants that fall under epidemiology, are the people that track STIs gonna be impacted?
So you gotta explain to people what STIs are.
Sexually transmitted infections. We don't classify it as sexually transmitted diseases anymore because the majority of them are infections and can be cured with an antibiotic.
I appreciate you saying that. So when we are sitting there talking about the business of health now, everybody has to have money attached to them.
Yes.
Nobody's working for free, folks.
No.
Just because, you got that good state job, that good state job is tied to funding.
It is. It is.
And we are talking about how funding has been cut off.